Karol Bassim is the Senior Program Manager of the Emergency Response Unit for International Medical Corps. She is in Caracas right now. Karol, what's the situation like on the ground as you walk around?
Hi, the situation remains extremely critical. Several days have passed since the earthquake, and tragically, many people are still trapped under a collapsed building. International Medical Corps conducted a rapid assessment in the affected communities in La Guaira, and within the first 24 hours, and what we saw was heartbreaking. People in tears, families searching for relatives, visible distress and trauma everywhere. People are exhausted. They're torn between hope and despair. Some are still waiting for news about their loved ones, and others are still grieving.
Meanwhile, your team provided CNN with images of hospitals that are just stretched to their limits. We can show some of that with some patients being treated in tents. What is the biggest challenge that your team is dealing with right now?
That's correct. The health system has completely collapsed, and with such a massive earthquake as we've seen, you can imagine there's a lot of difficulties. Access is one of the challenges. Roads are damaged, blocked by debris. The health facilities of lack of health supplies, medical supplies, medicine. There's lack of water, and as you can see on those photos, there's even lack of space, adequate space for the patients or affected communities to be treated. So our focus is on supporting those efforts and getting emergency care and supplies to these affected hospitals that are stretched thin. What matters most is coordinating, getting help as soon as possible, as quickly as possible.
So speaking of that help, how can our viewers help? What can people do?
Currently we are trying our best to support these overwhelmed hospitals that continue to receive large number of trauma cases. We're going to deliver essential medical supplies and working to ensure water hygiene conditions do not deteriorate. We are deploy a medical mobile unit, and we have 2 large field hospital pre-positioned. As you can see, this is a massive response, and anyone who wants to could support in anything related to medical supplies, equipment, food, NFIs. Anyone who wants to support our emergency as well, where can find more information at our website. There's a lot of needs. And there's a lot of mental health gaps as well, mental health and psychosocial support gaps.
Well, you're doing heroic work on the ground. It is so important, and we're so glad that you are there doing it. Karol, best of luck to you and all of the volunteers and rescuers and professionals on the ground in the days ahead. Thank you so much.